Dr. Greeny here. I'm a skin doctor. Today we're going to talk about retinoids and retinol, one of my favorite ingredients in any skincare routine. But I want to make sure that you're not making this mistake, so let's get right into it. If you want to get really great skincare advice from a 35-year-old guy that's gone to school for 13 years to become an expert on hair, skin, and nails, then like and subscribe. When people get started on their skincare journey, they get really excited about all the actives that are out there. But one big pitfall that you can make is using too many active things that can be irritating at the same time. So if you're gonna bring retinol into your routine, I recommend that you do it for 4 to 6 weeks, let your skin get used to it before adding in other active ingredients. When I think of other irritating actives, I think of things like alpha hydroxy acids. This is the ordinary glycolic acid 7% toning solution. So if you added this in the same routine with a retinol and you're starting both at the same time, you're likely to be over irritated. Other cleansers like beta hydroxy acid cleansers like salicylic acid can also cause this same kind of irritation. When people start a retinol, they can also get pretty dry and irritated, and sometimes their skin looks peely, and this can be very tempting to start over exfoliating your skin. Now, I personally do use mechanical exfoliation on my skin with a silicone brush once to twice per week. And that's okay, just don't overdo it. Skincare is all about consistency, and it's definitely not a sprint, it's a marathon. So make sure that you're sticking with your products for long enough to see the benefit. Many people may try a retinol for 1 or 2 weeks and feel like it's not benefiting them. Well, you probably haven't seen any benefits at this point. The benefits come after weeks, months, and years of consistent use. Retinol can help with skin texture, dark spots, and wrinkles. Sometimes people try to mix their retinols and retinoids with products like benzoyl peroxide. This is another big no-no because benzoyl peroxide actually inactivates retinols. So you may be applying the right products, but if you're mixing them together with products that inactivate the active ingredients, then you're doing yourself no good. Now, some retinoids like the La Roche-Posay Adapalene are actually stable when mixed with benzoyl peroxide, and there's actually prescription versions that come with those two medications mixed together. Now, a lot of people that use retinol and retinoids also have acne. They may also have more oily skin. A lot of the people with oily skin don't feel like they need a moisturizer, or they feel like if they use a moisturizer, they'll just feel too greasy. But not using a moisturizer is definitely a big mistake when you're starting retinol. It can increase the tolerability and make sure that you're staying consistent with your retinol. After about 4 to 6 weeks, your skin will be totally used to it and it'll be smooth sailing. But that doesn't matter because I know you guys already always wear your sunscreen every single day. Everyone's always asking me on social media, when should I start using a retinol or retinoid? Everybody's worried about starting them too early. And that's definitely not a problem. One of the biggest mistakes that you can make is not starting a retinol. The best time to have started retinol is yesterday. Like I said, retinol or retinoid is one of the most important ingredients to have in any skincare routine. It goes right along with vitamin C and sunscreen. The earlier you start a retinol, the better off you'll be. Now, it doesn't matter if you're using over-the-counter retinols or prescription retinoids. One big mistake you can make is using too much. Some of the common irritating actives that I think about are things like the glycolic acid toner from The Ordinary. This is an active acid. This is an alpha hydroxy acid, which has tons of benefits for the skin. Many of the great over-the-counter retinols have metered doses, so make sure you use just enough. I pretty much always tell patients to use a pea-sized amount, and that's enough to cover your entire face. When you're applying a pea-sized retinol, just dot your fingers together and apply it as such, and then rub it in. The issue with using too much retinol is you're going to get more irritation, and it's not going to help your skin any faster. There's absolutely no benefit to overdoing it. Retinols and retinoids tend to be used at bedtime, and this is important because they're inactivated oftentimes by sunlight. This is kind of a combination between two things. One, if someone's using a retinol day and night, they're probably going to get too much irritation. And two, if you're putting it on your skin during the daytime, it's going to get inactivated by the sun anyway. There are a few types of retinoids that are stable in sunlight, like Adapalene. However, there is some controversy about retinoids and causing you to be more sensitive to the sun. This does make some sense because retinoids do thin out the very top layer of our skin called the stratum corneum, which may predispose us a bit more to sunburn. Thank you guys so much for watching. I'm always here to help you get your best skin, so I'll see you next week.